We are doing a diabetic teaching presentation for group 12. Next slide. This is the pre-test. It has questions such as, what is diabetes? What are the different types of diabetes? Describe the different types. What are symptoms of diabetes? What are some complications of diabetes? And how do we diagnose type 1 and 2 diabetics? Our patient is a 45-year-old obese female who was admitted to the hospital for lack of controlled blood glucose levels. The patient has severe neuropathy and is at risk for diabetic foot issues. She has not adhered to any diet prior to arrival. Her blood glucose levels at admission were 430. The patient is alert and oriented ×3. Her heart rate is 85. Her temp is 97.8. Her weight is 247. She's 5'6". Her blood pressure was 129/84. Her fasting glucose during this assessment was 120. Her respirations are 16, and her O2 is 97% on room air. Our goal for our patient is that she will maintain a fasting blood glucose level of 90 to 120 and will be able to identify risk factors of pressure ulcers and proper foot care. She should be able to understand the need to test her blood glucose levels before administering her insulin, and she should be able to make healthier food choices. The importance of glucose monitoring. It is the most important thing that you can do to manage your type 2 diabetes. You will be able to see what makes your numbers go up or down, such as eating different foods, taking your medicine, or being physically active. It helps avoid hypoglycemic and hyperglycemic episodes. Your blood sugar needs to be tested before insulin administration. This could cause serious issues, including death, if you don't test before you give your insulin. There's different types of diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction. The body attacks itself by mistake. This reaction stops your body from making insulin. Approximately 5 to 10% of the people who have diabetes have type 1. Symptoms of type 1 diabetes often develop quickly. It's usually diagnosed in children, teens, and young adults. If you have type 1 diabetes, you'll need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. Type 2 diabetes, which is what our patient has. With type 2 diabetes, your body doesn't use insulin well and can't keep blood sugar at normal levels. About 90 to 95% of people with diabetes have type 2. It develops over many years and is usually diagnosed in adults, but more in children, teens, and young adults. You may not notice any symptoms, so it's important to get your blood sugar tested if you're at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes such as losing weight, eating healthy food, and being active. There's also gestational diabetes. It develops in pregnant women who have never had diabetes previously. If you have gestational diabetes, your baby could be at higher risk for health problems. Gestational diabetes usually goes away after your baby is born. However, it increases your risk for type 2 diabetes later in life. Your baby is more likely to have obesity as a child or teen and develop type 2 diabetes later in life as well. How diabetes is diagnosed. There's several tests. You could have an A1C test, a fasting blood sugar test, glucose tolerance test, random blood sugar test. I don't know why that glucose tolerance is on there twice. Okay, insulin administration. You can use a syringe. Your doctor will tell you how much insulin that you need per dose. Smaller capacity syringes are easier to use and more accurate. If your largest dose is close to the syringe's maximum capacity, buy the next size up in case your dosage changes. If you need doses in half units, choose a syringe with half unit markings. There's also insulin pens. Some pens use cartridges that are inserted into the pen. Others are pre-filled and discarded after all the insulin is used. The insulin dose is dialed on the pen and it's injected through a needle. Then there's the insulin pump. An insulin pump is about the size of a small cell phone. It gives you a basal dose of short or rapid acting insulin per hour. When you eat or when blood sugar is high, you calculate the dose and the insulin pump delivers the bolus. The pump delivers insulin through a thin plastic tube placed semi-permanently into the fatty layer under your skin, usually in the stomach area or back of the upper arm. Your doctor or health education specialist will show you how and where to place the tube.